It's not the first thing you think of when it's start of the new year. You have resolutions, but let's talk about medical care and your medical directives. And with us today to tell us more about that, we have Matthew Etzkorn. He is the Vice President of Mission at Mercy Health St. Rita's. And thanks for joining us today.
Morning. Great to be with you this morning.
Okay, so it's time maybe to rethink or refresh our thoughts about our medical wishes, right?
Yes, yeah, very timely.
All right, so is it because of the pandemic, or do we think of this every year? Should we think about our medical wishes and what we want?
Yeah, great question. I think it's every year. We've been doing this for years, having conversations with community members about the importance of advanced directives.
Okay,
especially
so,
with the,
go ahead.
With the pandemic, it's very timely, and we're finding that even more people are interested in this topic.
Okay, so let's talk more about advanced directive. What exactly does that mean?
Yes, it's basically saying in advance what you would want done, expressing your wishes in advance with your healthcare decisions.
So do you have to have it in writing, or is it just good enough to tell a family member or a friend?
Well, both are important. It's good practice to have it in writing. We have two documents in Ohio that we typically work with. One is a healthcare power of attorney form, and the other is a healthcare living will.
Okay, so where do you get like papers and things for guidelines to write this up, or do you go to an attorney?
Yeah, there's several ways you could do this. One is to go to an attorney who can help you fill out the form. And then we have at our hospital here and many hospitals across the United States, people that are trained especially in advanced care planning. So we have, with Mercy Health, we have nurses, social workers, and chaplains that have had specialized training for those sorts of conversations. And a lot of times people start with their family physician too.
Okay, so off the top of my head, I'm thinking, well, this should be something that just older people should be doing. But I take it you're going to give the advice that everybody should do this?
Yeah, I think it's good practice for any adult to start an advanced directive. I myself, I'm in my 40s. I have both a power of attorney and living will, my wife as well. But yeah, I think it's good practice. The power of attorney simply is somebody that you specify that to be your agent, to speak for you if you're unable to speak for yourself. And it's not always in, like, people think of end of life decisions, and that's a big part of it. But it might be as simple as you're in surgery, you're under anesthesia, and you need somebody that you trust to speak for you to help the surgeon answer some questions.
And I assume it's a good idea to do this every year, because just little things can change in your life, your thoughts, or like even the family dynamics can change. So that's why you should look at this yearly?
Yes, yeah, it's a good practice to have those conversations. They're not one and done conversations typically. It's ongoing with the family members. Yeah, our health changes over the years. We might develop a chronic disease and new things come up. For instance, with COPD, which is a chronic disease, people might be thinking about the breathing machine or life-sustaining treatment. Would I want to have that tube, down my throat to help me breathe, that life support?
So I feel like this will be peace of mind not only for the person writing out the directives, advanced directives, but also for family members too, because then you're both on the same page and you know what is wanted. Yes,
you got it. As a board certified chaplain over the years, I've journeyed with a lot of families with these tough decisions. And what happens at times is, the person's in the ICU, and this is the first time that they've even thought of these questions. And so they never had a conversation with their loved one, say it's their father or mother. And they're being asked to make these really important decisions, and they never had that conversation. So the real gift is to have those conversations ahead of time.
Yeah, it might be kind of hard to start the conversation, or you don't want to think about it, but just get it started. And so, as you said, get the information, get the paperwork going, and just make these decisions this year.
Yeah, it really gives people a peace of mind. People sometimes will go away with guilt even, or doubt about, did I do the right thing for my loved one? So.
Yeah, advanced directives will help out with that decision. Well, Matthew, thank you very much for joining us today and talking about this issue.
Yes, my pleasure.
All right, don't go away. New Edition continues in a moment.
Do you have